It.
It says that you have started screen sharing. There you go. Perfect. So, ladies and gentlemen, just before I formally hand it off, I'll go through a brief introduction of Dr. Gajjar. Now, the only problem with his introduction is that if I try to do justice to it, it'll eat up half of his presentation time. So I'm just going to give a summarized version of it. He's a past president of Academy of General Dentistry. Dr. Gajjar was born in Newfoundland and graduated with honors from Stephenville Integrated High School. Dr. Gajjar is extremely active in continuing education. In addition to attending courses, he lectures on managing medical emergencies in the dental office and has held teaching positions at both college and university level. He has served on various committees of various organizations like the ODA, the CDPA, the AGD, the SADA, which is the South Asian Dental Association, obviously ODI being the Ontario Dental Association, Canadian Dental Protective Association, which is CDPA, and has served as the Canada East region for the Academy of Dentistry International. He has acted as a curator for the Canadian Dental Aptitude Test, which is the DAT, and has been a clinical examiner for the NDEB exams. He's a master of the Academy of General Dentistry, a fellow of the Academy of Dentistry International, fellow of the Pierre Fauchard Academy, fellow of the International College of Dentists, and a fellow of the American College of Dentists. He is certified in IV sedation and serves as the official dentist for the Miss India Canada pageant. That's something people will be jealous of. Sohag Application Group and Fashion Flair. Amazing. He practices in Mississauga, Ontario, and lives there with his wife Sona and children Caden and Kian. He is highly experienced on the political side of dentistry, and we will be sometime either today or down the road getting his opinion on the ongoing RCDSO elections as well. But not at the moment. For now, it's now over to Dr. Gajjar, who will be talking about the dentist in the lion's cage. The lion's cage being Canadian dentistry, new dentist thrown into the lion's cage to go take care of himself. And what does he need to do? Dr. Gajjar will tell you.
Well, boss, thank you so much. Hopefully everybody can hear me and see everything okay. Is that a thumbs up? You're good there? Okay, perfect. Boss, what you do here is incredible. You bring together all the resources for everybody, and this is a lifetime opportunity for your attendees, for sure. And for that, you need to be commended, because it is incredible. Disclaimer, I don't have anything to sell. I don't have anything to offer. But basically what I'm going to tell you is that we are all in this together. And while you hear a lot of things that can be frustrating, trust me, it's frustrating to us that are practicing. And again, you're not alone in this, and hence the importance of joining a lot of organizations that, you can talk to other people and understand that, what, it is what it is, and we just basically have to work together and deal with it. I do have a habit of sometimes getting myself in trouble in these presentations. The last time I did one of these, I decimated a supplier, and then found out that the supplier is speaking right after me. So, I'm gonna give you the truthful information, and hopefully at the same time, respect the opinions of everybody else who's involved. Our previous speaker is incredible. You need definitely all the resources that all the explanations, and understand what you're getting yourself into. Unfortunately, sometimes, you may not have a choice. The landlord may want a personal guarantee. Well, you know what? You're going to give it to them, because you're not going to give up a great location because a personal guarantee being a deal breaker. But you have to know those things. In addition, most leases now in new buildings will have a demolition clause. If you own the building, you would put one in too, because somebody offers you $100 million for your 1 acre piece of land so they can build 1,000 condos on top of it. They're going to say goodbye to Mr. Dentist. That's just the reality of life. And so, if you can get 15, 20 years out of a practice. And if it is, if that's the term of it, you need to take that into your consideration. But don't walk away because sometimes there's so many negatives in the deal that's been presented. Abbas, your audience here definitely has a number of different types of personalities. Some will definitely be associates. Some will definitely enter into the different models of dentistry out there, and some will become owners. And hence associate contracts are a big part of it. I know there was some discussion on restricted covenants. I can tell you for the last 15 years, I don't put in a restricted covenant in the traditional sense of the way. If you're an associate in my office, you can practice across the street if you want to, but there's a condition. If you practice within certain distances of my office, you agree that I will take a percentage of your revenue. Whether that's going to hold up in court or not, that's going to be at some point tested. But I am not preventing you from practicing your livelihood. What I'm doing is setting an agreement right up in the beginning that if you want to practice within a certain distance, then you're competing with me. And as such, you're going to give me a percentage of your revenue because you've taken it away from me. Like I said, sometimes it helps to be creative. And again, nobody knows what's right and what's wrong, but hopefully it helps the new grads coming out and the new dentists that start practicing. There's always numerous ways to skin a cat. Abbas, please monitor the questions. This is a very informal talk. I know we're limited on time, and at any time, anybody can reach out to me, reach out to you, and we'll stop for Q&A at any time regarding anything. I have a number of topics, but I have a tendency, depending on where the audience wants to go, that we will deviate from that. So there's no hard and set rules here. Make sense, Abbas?
Wonderful.
Perfect. Infection control, this is the biggest nightmare that's happened pre-COVID. Offices were being shut down. There's been, class action lawsuits. This was one of the biggest stresses on dental offices, maintaining logs, sterilization, which pouch was where, what, biological indicator did you use, type 1, 2, 3, 4, logging all these things, being able to track all these things. Industry started developing out of these things. It was truly a nightmare and still is to some extent. However, COVID has kind of reset the clocks, and now it's distracted the inspectors from looking at detailed infection control to the overall picture, which I think is the way it should be. I think dentists are very well trained in infection control, as well as their staff. And I think that these inspectors should spend more time with people that aren't as trained, i.e. tattoo parlors, i.e. hair salons, nail salons, and so on and so forth. Protection of the public is important, but I think that this is something that should be left within the hands of dentists. I think we treat our families in our office, and we would not do anything that we wouldn't do to our own family that we would do to our patients. Disposables. These are the same slide decks from last year, Abbas, if you remember. I haven't changed anything. And last year we were talking about infection control, the amount of disposables and the landfills and everything else. We have now gone from disposing in my office 4 garbage bags a night to almost 8 to 10 garbage bags a night, just on straight disposables. This is going to be an environmental nightmare in the future. And we're going to have to figure out some ways that, we can reduce the amount of disposables. While yes, you are preventing infection and protecting our patients, at the same time, you're doing harm to generations down the road. So this is something that's going to become very important as we move forward. Handpieces, this has always been a discussion. We use the same handpiece after sterilization on patient to patient. There's been a big debate whether handpieces should be disposable as well. And this is going to become a big big issue as we move forward and they start looking at what should be done with these types of things. The biggest issue with offices, and this is why many people choose to go to an associateship or a working model instead of an ownership model, is the amount of tests and the amount of paperwork that's now required on everything we do. Your equipment needs to be tested, by HARP every year for HARP certification. You need to keep logs of everything. You need to do step wedges. In addition to that, curing lights have to be tested every day. You don't want to be sitting there and curing something when your light is not delivering at 480 nanometers. Your material is not curing. Your patients are coming back with sensitivity. You're re-drilling these things. It's a bad PR move. People start saying that, oh, you know what? Every time I get a filling done, it's sensitive. Well, it could be the curing light. So, these small things that, you don't realize until all of a sudden you have a pool of patients coming back with increased sensitivity that you realize and start looking at, okay, what seems to be the problem here? Nothing has changed from when I graduated to what I'm doing now. I'm using the same material, I'm using the same bonding agent, and all of a sudden you realize that, your curing lights aren't curing. And so small things like this become problematic as we move forward. And you always have to keep your eye open. You have to listen to your patients. You have to make sure that, you understand the feedback you're getting, and there's a reason for it. There might be something that has gone astray. And curing lights is one example of it. Sometimes, the assistants have changed the bonding agent because one of the reps have told them that there's a 2-for-1 or 3-for-1 deal with 3M or Ivoclar or somebody else, and then all of a sudden, not that the material is bad, but your technique is not the one that's been prescribed by the manufacturer, and as such, you're getting sensitivity from that. So, those are issues you need to look at. The biggest issue by far in any dental office is staffing. The people that we need to work in our offices need to be trained in a very niche market. It is difficult to find that. Even the receptionist needs to have enormous amounts of training to field those calls. They need to know what the problem is. They need to know who to book it with. They need to know timing, management. They need to set patient expectations. It's not easy. And I'll tell you, it's getting harder. We put out ads. We use Indeed, Facebook, social media, you name it, to find staff. And most of the time, yes, we schedule an interview, and people don't even show up. So it's tough. And then once they actually do, retention becomes a problem. And so this is becoming a big problem. And I'll tell you one thing. I was in Woodbridge this summer, waiting for a sandwich, and there was a group in front of me of young. They weren't teenagers, but they were definitely younger than me. So, I overheard them talking. 3 out of 5 of them didn't want COVID to end because they were getting $2,000 a month, and previously they were working 2 days a week. And so now people have become accustomed to a certain baseline without even working, and now try to get that same, staff to come back to the office.
And it doesn't get better when the government has been contemplating on a baseline income strategy.
Yeah.
The good flavor of what it's going to be like. And I'm sorry for interrupting, but I just
no, absolutely.
But you see, the other thing is about they say what's the difference between God and dentists, and the difference is that God doesn't think of himself as a dentist. So, and that image of ourselves comes crashing down when the staff doesn't show up for an interview. That crumbles all the godliness you have in yourself.
Yeah, no, it's tough, and I've been practicing here for 20 years, and we've seen we've gone from, there being a shortage of hygienists, and then everybody went into hygiene. Then we had a surplus of hygienists, where I would be on the golf course and I'd see hygienists driving the beer carts and stuff. And then now we're in a shortage of assistants. Hell, we're in a shortage of everything. Even finding receptionists is tough. So, I don't want anybody to get discouraged. These are problems we're all facing. It's not just, okay, why isn't nobody applying for the job at your office? Nobody's applying for a job at my office. So it's it's a tough situation we're in. And again, you know what, COVID, there is a level of fear out there. And even if you have good staff and dedicated members, there is some fear. And whether that fear comes from themselves or comes from their families, then, I don't want you to go into that environment. And, that's legitimate. So it is becoming tougher. And remember, without a staff, then the doctor can't practice. And if the doctor can't practice, then there's no revenue coming into the office and the bills can't be paid. And it just becomes a vicious cycle. So again, not to harp on that, but staffing is the biggest problem, will continue to be the biggest problem, and is your biggest cost moving forward. So keep that in mind. And now we get into the cost of dentistry. Cost of maintaining all these logs, the cost of getting a health and safety manual, an IPAC manual, the training, the CPR certification, the hours of continuing education that you need to be out of the office. This is driving the cost of dentistry up. Pretty soon, what are we going to be at? We're going to be at $2,000 for a root canal. I remember about 5-6 years ago that the patient came into my office and, we did an extraction. And sure, it took me probably a couple minutes to do so. And then at the end of it, we charged him $100 for an extraction at that point. This was before the big increases. And the patient said to me, that's how much I make in an entire day. And it took you 2 minutes to take that tooth out. And, it never, I felt bad that day, really bad. And I think I felt bad for weeks and months after that. Like, what are we doing? That's true. It took me 2 minutes. And then talking to colleagues and stuff, a good friend of mine, Dr. Felice, said to me, he goes, you're missing the bigger picture. Picasso was on the street and he put 2 strokes on a piece of paper and he said, what, $1 million. And the guy goes, it took you 2 seconds to do that. Well, no, it's, it took me a lifetime. And don't ever forget that, the training that you guys have gone through, the costs, the licensure fees, the training, and you know what, all the costs that take place in the office. People don't understand it, but that 2 minutes cost you almost $500,000 in education to get to that point. In addition to that, when a patient's in your operatory for 2 minutes, it takes 5 minutes on the phone. It takes 10 to 15 minutes when they check in to get their information and fill out the medical. It takes 5 to 10 minutes to go over that medical. It takes 5 to 10 minutes to exit the patient out. By the time you add up all these costs and the number of people and the salaries and everything else you're paying, plus all the sterilization and all the other additional costs that go into preparing the equipment to do that 2-minute or 3-minute extraction, that's where the $100 goes. And so, and when you get into explaining that to the patient, now you've also killed another 30 minutes of your time. So, sometimes you reach that battle. Okay, you know what? Am I going to argue with the patient as to why my fees are so high, or am I going to sit there and say, okay, you know what? Here's the discount because it's not worth the time to educate them. But I think we all have a duty to educate them because otherwise this behavior will continue, and we all have to do our part to make sure that people understand why dentistry is so expensive. And it's not because the dentists are making all the money, it's because the cost of delivery is so high. Service organizations, I have many different types of views on this. I know right after me, Dr. Suta is going to be speaking. So he's the expert in dental service organizations, and I will leave that to him. I will say something. I served as the AGD president, and during my time, I was able to meet with many industries from ADEC to Ivoclair, and they're top CEOs, in fact. And and look at this whole model over the last 10 years. Initially, there was a lot of fear for these companies that, oh, you know what, these guys are going to start controlling prices and so on and so forth. And then for whatever reason, that model didn't come to that fruition for these suppliers and manufacturers. And there's a number of reasons, but some of the things that we can talk about is that there, and I guess Dr. Suda is going to talk about the different models as I see on the agenda, but there are some companies that basically brand their offices all under one name. And there are other companies that basically brand their offices under a different name. And I get why, because you know what, if something happens in my office, then the whole name isn't ruined across the board. It's limited to one office and you basically, cut your liability there. But in doing so, you don't take advantage of the marketing scale of doing business. Versus if everybody was called, ABC Dental, when I run an ad across the nation on ABC Dental, everybody benefits. Now I got to run an ad for Neil Dental and Abbas Dental and Sina Dental and so on and so forth. So, there's no savings there. The medical model was an interesting model with these big companies like Kaiser Permanente and stuff. You build a big hospital, you put all these doctors under one roof, and you basically, everybody's using the same Q-tips, the same supplies, etc. Well, that didn't work out in dentistry. I want a 3M product, you want an Ivoclear product, somebody else wants a Dentsply product. And as such, everybody ended up, there was no cost savings in volume buying per se, other than the fact of using one supplier that ultimately deals with all these manufacturers. And the final thing is, we haven't seen any of these real corporate entities hit Wall Street. I don't know if anything has changed since the last time I have looked, but you got a company like Uber or Lyft that has no assets, that has generated billions of dollars on the market, and for some reason people aren't willing to invest into dental operations other than venture capitalists. Now, things may change in the future, but it's keep that in mind that there might be some reasoning behind there without, like I said, hurting any feelings out there with the other speakers and stuff. So again, we can always talk about this more offline, but it's an interesting scale. And remember, guys, feel free. If you feel that you want to run your own practice with your own shingle on the wall, do it. It is a good business. There's a reason why everybody's buying out and doing multiples for practices. It was on the Forbes 500 list for the longest time as the #1 profession. I think the vets have bet us to that now. And it's interesting. One of my friends was telling me that they brought their dog to their vet, and before they even took the dog in, they came to the parking lot with a credit card machine and charged the card and basically brought the dog in and said, your dog has some depression, and we're going to give him some benzodiazepines and charge him for the prescription, which they had the number inside already. So you can't beat that business, and you can't beat the business where you can charge $500 to $1,000 to have your pet's teeth cleaned, whether it's a hamster or a dog. So maybe we did miss the boat on that one. Veterinarian was the way to go. So anyways, a lot of third party. How am I doing on time, boss? You know what? About 5-10 minutes, or am I over?
To be fair, we are 15 minutes behind, so we're gonna keep
That's okay. If I'm
online, we will just shift it 15 minutes. That's okay. You have up until 11:30.
No, if your audience is getting bored, don't worry. You can pull the
no, they're not.
The chain on me.
They're not.
Right?
I guarantee that.
A lot of third-party disruptors coming up in the market. You guys all know this. Do-it-yourself ortho. This is incredible, and I'm going to tell you straight out. They use this as guinea pigs. Whether it's Invisalign, Smile Direct, or any one of those guys, you entered all this information over the last 20 years from orthodontists, general dentists, that this is how teeth move. They saw the befores and afters and everything, and they developed algorithms that can do a job probably better than any dentist or specialist out there. And guess what? We don't need you dentists anymore. We can go direct to the public. They're selling the stuff at Macy's. They're selling it on Matheson here in Mississauga. You go right into the location, they scan you in, and boom, you got aligners coming to your house. This is a disruptor because now it's taken away from the required supervised direction of specialists and people who know what they're doing. And so, digital dentures. I know Ivoclar has been on the forefront of that, and they promised that they'll always keep the dentist in the picture, and I know their top brass pretty good, and they are good people, but in the future you don't know what it holds, right? It may not be them, but somebody else uses the technology to order dentures on Amazon at some point, right? So you don't know, but keep these things in mind. Shoppers in Walmart are going to become competitors. Now you have a clear SDF, silver diamine fluoride, that's received FDA approval. So, if you got caries and you want to, especially in pediatric patients, forget pediatric patients, even adult patients, and you don't mind the way it looks, but you just don't want to get it getting worse, go pick up a bottle of SDF at Shoppers and Walmart, and that care is at least deferred for many years. And so that's potentially revenue away from dentists and from us restoring, active caries. But it's also good in the sense that, it allows people to mitigate pain and to control situations when, times aren't good, and they, until they get their insurance or get back on their feet and have the money to get the treatment done. So, times are changing. We said goodbye to metal. We ended up with zirconia. Why? Metal is incredible. Like, amalgam. I think it's the best material ever. If you patients want that, I'm the first guy to put that in. It lasts forever. It is the best. Whereas resins, they break down. The environments that we're in, the acidities, the non-fluoride municipalities, there's an enormous breakdown on this. And I guess it's good for dentistry because you're replacing these things every 5 to 7 years versus amalgam you replace every 20, 30 years, right? But so while you're losing on one end, you're gaining on the other, I guess. So anyways, you know what? Bottom line is, there's always ways we can improve our practice. Listen to your patients, listen to your staff, make everybody part of the team, and you'll be surprised at how much you'll be able to improve. Basically, sometimes we wonder, why are no patients coming to my office? Well, sometimes when I go into my friends' different colleagues' offices, and then the phones aren't ringing. Well, the phones aren't ringing because you put your entire staff on lunch from 12 to 2, and nobody's here to pick up the call when everybody has time to call you. And then they realize that, yeah, we missed 30 calls during our lunch break. Well, that's the only time some people have the ability to call you is during their lunch break, and you're taking the lunch at the same time. Or they lock their doors and they all go in the back, and patients are knocking on the front, and nobody's there. Sometimes even the way people pick up the phone, like, you pick up the phone and put me on hold, I'm not going to hold too long. I'm going to hang up and I'm going to call the next dentist. So, that's your first point of contact, and you got to train your staff to be able to, capture as much information just in case you get disconnected. Who am I going to call back? Just in case there wasn't an opening that day and a patient ends up booking somewhere else. Well, you know what? We have an opening. We can call you back and say, okay, we can get you in earlier, right? So small things. And, technology is changing. Now we're able to communicate with email and text and so on and so forth. And, we had this discussion with my staff yesterday. I'm not a big fan of these things. I'm when I go to the bank, I don't like seeing tellers in jeans. That's just me. I'm old school. Likewise, I like decorum and I like professionalism, and I like the old school phone call. I want patients to experience that.
Let me sit up straight.
Yeah. So AGD, it's small. The only plug I'll make is, it's a great organization. Dentists that are CE junkies that love continuing education. And Abbas, it was great to see that you're PACE certified now, and you're offering AGD credits, and you can get that towards your fellowship and mastership. Every time you learn something, your practice becomes better. Your practice becomes easier. But more so than that, in today's tough times where there's so much mental stress on dentists, so much mental stress. And, I'll tell you, it was kind of embarrassing post-COVID when I looked in my garage and saw the number of empty bottles out there. It's, it adds up, and it's good to talk to your colleagues and unwind and say, I'm not the only one in here. We're all in it together. And once you realize that, and if you practice long enough, you'll all get a complaint. It's part of life, and it frazzles you. I didn't do anything wrong. And sometimes, your attitude is to do the right thing, and you dig yourself a deeper hole. And we see this, serving on PLP and other places at the college. This happens. It does. It will happen. And you know what? Like everything in dentistry, you will get through it. So, keep positive. We're all here for you, and just continue to do the right thing and continue to practice, and you'll be in good shape. Boss, that's pretty much my quick talk. Hopefully I did it within your time frame. I think so. And
no, I think you did an amazing job. I think it's a bit unfair that people got to listen 15 minutes less of.
No.
But amazing summary. I think what you've shared is some of the things will probably people will turn around and think about this a couple of years down the road. Oh, I remember Dr. Neil Gajjar said this. Now I know what he meant. So no, that's a great summary, Neil. And just to add some, not to add some spice, but yes, maybe just to make it a bit interesting, I'm going to put a question about if you've got so much experience in dealing with the politics of dentistry in Canada. So where do you see the situation here, considering that our audience and our listeners will be a part of this very soon, and some have already kind of stepped into that space?
Yeah, there's the politics, there's the organized dentistry, there's many different aspects out there. And those that have interest in it, have interest because they genuinely want to do the right thing. And as such, you'll always have options. You'll always have the ability to choose which leaders you want to send to the forefront. And I think most people, like I said, have the innate tendency to do the right thing, and you'll get the right people up there, and they'll be fighting for you. It's the politics is severe, and I think we've seen it this very strongly this time with the different colleges. Not only within our spectrum, but also within medicine, between the doctors, the specialists, the nurses. It's there. There's turf wars, and it is. It's taxing. But I think we got the right people out there, and we'll always have the right people out there fighting for what dentistry should be, should look like in the future, and protecting our profession. That's the biggest thing out there. We have a luxury of, and I told this to the staff yesterday when I walked in the office. I looked at my open sign. It was lit. So, this is the biggest thing that we should be grateful for. We all have a job. We're all working. The sign is lit. We're serving patients. Don't take small things for granted. Somebody's out there fighting for you. Somebody's out there doing something to maintain that sign is still lit for you and your staff and your family and your patients and your community. So I think, yes, politics is there. It'll always be there. But it's politics by professionals. So more so it's governed by differences of an opinion as to what is right, as opposed to U.S. politics that we see on CNN and Fox Daily. So that's my 2 cents on that.
So do you think that the balance of the regulatory role that is on paper, or which is the spirit of the act of regulation, are are these being nicely balanced and practiced at the moment, or is there a kind of a, is it skewed in one direction between protecting the patients and slapping dentists on the wrists and stuff like that?
You know, I think I think the best way of looking at this, are there issues? Sure. You know, can it be, the question is, it could be a lot worse. I think patients are protected fairly. I know the complaints process sometimes is a little bit longer. Uh, you know, but I think it's fair. You know, you have dentists there, and like I said, I sit at PLP as well. We look at cases. Boss, it's very clear, very easy once you've seen numerous cases to understand who's a good dentist that found themselves digging themselves in a deeper hole to try to help the patient, and who was malicious. And sadly, you know, there's always a few bad apples everywhere, and you know, those are the ones you got to deal with. We call them frequent flyers at the college because they constantly show up over and over and over again. They don't learn. And those need to be disciplined. But remember, this is their livelihood too. You want to be able to reform them and not, you know, totally remove their way of life forever. But once they become a danger to the public, then you really have no choice. So I think, you know, ultimately, you know, nothing works the way you want it to work. Nothing's ideal. But I think, you know what, we do have a good system. I think it's a very fair system. I've seen systems in other places, and I would have to say that, you know what, you know, I'm happy with it for whatever that means. But you know, is it perfect? No.